about, it's even if we talk about, say, basic life support or advanced life support, everything comes down to heart, brain, circulation. That's all. That's all that matters to all of us. Because when we talk in layman terms, we talk about heart attack or you talk about brain stroke. These are the two most commonly heard. Or the maximum you talk about is road traffic accidents, which again is a part of circulation, or it is part of blood, what we're talking about. So to understand, it's basically heart pumps blood out, goes into the brain, to the main vital organs. And what we do in BLS or what we do in any life support is basically to push that whatever remnant of oxygen is there into the brain. So what we do in CPR or what you do in chest compressions is nothing but you're pushing out the remaining amount of oxygen which is left over in your heart to the brain. Because brain has a very short period of time for which it stays alive. So we want that to be the golden period. That's all. That's all is expected out of anybody when you do a basic life support. So these are the vital organs. I believe I don't have to stress over it. It's like from brain, from heart, it goes to the lungs, brain, and then it is all support. You need it to the liver and the gut. They are the 5 main organs which have to run. Doesn't matter even if the stomach or the liver shuts down, we need the upper 3 to work for us. So if at all you have somebody who's unresponsive, or say your workplace colleague, somebody has collapsed. These days it's nothing like this age specific limit that above 50, below 50, above 60, nothing like that. We're seeing as young as 14-year-olds, 15-year-olds having heart attacks. In layman terms, having heart attacks could be due to different causes. So if you find somebody unresponsive, what do you do? Instinct, first instinct, what do you do?
We try to wake him.
Yes, that's our first step. We try to check for the response. Right? If you find somebody lying on the floor or on the staircase, our first response would be to try and go and wake them up. Are they actually awake? Or, they are blinking their eyes. You want to see the different kinds of responses for them. So if you find that they're not responding to your tap or, to your, we give a hard massage on the chest, to none of them they're responding, then what do you do?
CPR.
We'll not talk about all of this. I'm just asking as a basic instinct, what do you do?
We call the ambulance.
We call for help. If you're alone, there's somebody else who's collapsed beside you. Our instinct is to shout out loud. Correct? That we want help. Somebody please come. So first we check for responsiveness and then we call for help. That's the basic step of BLS as such. That's the first thing we look for. If at all it happens on a staircase, you're walking and somebody suddenly collapses. You can't stop in the center of the staircase and do all of this, right? You want to pull him aside. So that's the first step of BLS, the scene safety, where you make sure that you are safe. The person whom you are handling is safe. It can be in office, it can be in the center of the road. Something might happen and you would really want to go and help them. But you cannot do that standing in the center of the road, right? You would want to pull them aside. So that's the scene safety there. In the hospital, when you talk about, or when we talk about, say our beds are elevated, we want to keep them flat. That's our scene safety there. So it varies from place to place, but it's just to make sure that you are safe and the person you're handling is safe. You don't want to cause more damage. That's all. Second, we check for response. That was what everybody told, that whenever you see somebody who's unresponsive or who's lying on the floor or who's not responding to you, just giving that blank stare, we check for the response. That's normal human instinct. And then we follow it up by calling for help. Clear? So far so good. Then the next, you've checked that there's no response. What do we do next? You called for help. But then you want to know if he's actually alive or dead. Correct? That is felt by feeling the pulse. How do we feel the pulse? It's not anywhere here. It can be because the patient has a low blood pressure or must be a chronic smoker. We won't be able to feel the peripheral pulses. So we want to feel only one, which is the main, which goes to the brain. This is called as the carotid, or main artery which you feel in the neck, which goes to the brain. Very easy to identify. Please put your hand in the center of the neck where you feel your cartilage or you feel the ring-like structures, right? Just beside that, slide your fingers beside that, you have a groove or you have a space, correct? Before the muscle kicks in. So you have a depression kind of a thing. That is where we feel our carotid pulses. That is where you feel the pulse for the patient from our side. That is where you would like to feel the pulse for anybody. Alright? So this is called as carotid. You can check it on either side. Please don't put your hands on both sides. Not one. You cannot stop both the carotids at a time. Feel one. Okay, and at the same time, you would like to see if the chest is moving or not. That is a sign of breathing. So this is a sign of circulation, or this is a sign that the heart is beating. And when the chest moves, it's a sign that the lungs are functioning. Okay, so that is, we check for breathing and circulation at the same time. We can't afford to lose a lot of time, because as we lose time, the oxygen in the blood depletes. So you don't want to lose a lot of time. So what do we do is, we check for the pulse and the breathing together at least for 5 seconds and not more than 10 seconds. Okay, that's the maximum time we give. That's the maximum time we give. So we count 1, 2, 3, 4, 5, and we would give them 5 to 10 seconds maximum. And it is either there is a pulse, there is no pulse. It is no midway between that there can be a pulse, there could be a pulse. No. You're able to feel it, you're not able to feel it. That's all. In that moment of time, you're not able to feel or appreciate it is more important rather than thinking it could be there, it could not be there. So once you've decided that there's no pulse, then what do you want to do? Patient is not responding. You are in a safe environment, you've called for help, and you've decided that, there's no pulse, he's not breathing, or the person is not responding to any of this. So what would you like to do next? You've called for help, they have to come, right? It takes a brief period, at least it takes a couple of minutes for them to come. No matter they are the fastest response, also it takes time.
So we need to make sure that the circulation and blood.
Yes. So we need to start for chest compressions. How do we do chest compressions? Anybody has ever given at home?
No.
No? Never? Never had the opportunity to do?
No.
How many of you work out?
I used
Good. Try giving CPR, you won't need to work out. So this hand or your non-dominant hand goes down in the center of the chest between both the nipples. This is called as a nipple line. Okay, we don't put it on the left side like how it's shown in the movies. No, because the ribs are very, very friable. You put your weight and you bend down, it will break. So we put it in the center of the chest where you have a hard bone in the center, right? That's the sternal bone.
Yeah.
So on the lower end of the sternal bone, or on the lower end of this bone, this is where we put it. So this is where we put our non-dominant hand first. Over that comes the dominant hand, and we don't bend at the elbows. So the pressure comes from my back, doesn't come from my shoulders or from my elbows. Why? Because when I'm giving CPR and I bend, if this bends, my entire weight would be on my elbows. I wouldn't be able to give an effective CPR. I'll be tired end of the day. And maximum time where we can allow CPR is 2 minutes. Because if you've given effective CPR for 2 minutes, you'll be panting for breath. Okay? So this hand down on the sternal bone, or the lower end of the sternum, that's what we call it. Over that we put the dominant hand, place it on the patient's chest, bend forward so that the pressure is coming from your back, and this acts as a fulcrum. Okay, that is how we give CPR. Understood? Clear? This is the most important aspect of this entire presentation here. This way, and this is how I would give. I would never do this, nor I would do this, because I want this bone to go in at least 2 inches deep. That is where the heart lies. So it has to go in, and then it has to come out also. That's called as a chest recoil. So I would like it to go in and come out, and then again I would give another one. But this entire thing happens so fast that I would like to give it at a rate of 100 per minute. So my entire concentration will be only on giving chest compressions. I wouldn't be able to do anything else apart from counting and giving chest compressions. Alright? And we give it because here in a setup you wouldn't be having anything to give ventilation as such. So what we suggest is, please do not ever give mouth to mouth. That is fixed only for movies. It doesn't happen in real life. You don't know what kind of infections they are carrying. So at least use a barrier. You can use your hand, if not anything else. Open the mouth and then we give breaths over it. Okay? Please do not ever attempt mouth to mouth respirations or mouth to nose respirations. Mouth to nose and mouth to mouth. They were there once upon a time, but not anymore. Okay? And how do we give that? See, normally what happens is when you sleep, your tongue tends to fall back. That is how people have snoring. Correct? But when the same thing happens when somebody is not responding to us, or they are not in their complete senses, you hear the gargling sounds, right? Gur, gur, gur sounds. That happens because the tongue is falling back. They're not able to swallow their saliva. Saliva is our natural secretion. Our windpipe is straight, but the food pipe is to the side. Okay, whenever we are not in our complete senses and we tend to take food, it goes into the windpipe straight because that lies exactly straight. So that is why whenever somebody is not responding, we ask you all or we ask anybody to hold this way. This is called as the head tilt and chin lift. Why? Because it aligns and makes this entire thing straight, so that whatever air we are giving goes directly into the lungs. We don't want the air to go into the stomach, because unnecessarily stomach will get distended or it will become big, push the lungs up, causing more problems. So that is why we say open the airway. This is called opening the airway. So if I'm lying down flat, I would like to push this up. Just as simple as that, push this up. So it makes the head straight. It makes this entire system straight so that the air is pushed into the lungs. Alright? So we give CPR at 100 to 120 compressions per minute, going with depth of at least 2 inches. And we allow complete chest recoil. That is, when we push down, we want it to come up. Because if you're continuously pushing down, there's no way that the blood is going to come out.
Sure.
If you keep pushing and giving pressure on it, how would the blood flow out of it? So that is why we allow for complete chest recoil. Alright? Nothing more than that. As simple as it. And till how long can you do it? What we say is give 30 compressions and give 2 breaths. So we give 30 and then we'll try to give in 2 breaths. You have this bag and mask with you in your whatever area, fine. You don't have, then we attempt to give it by using your hand as a barrier or using a handkerchief as a barrier. You can use anything, but not orally, mouth to mouth. Okay? Use a barrier and you can give 2 breaths, 30 compressions and 2 breaths. But if it's a child you're seeing, children might choke and have that problem. So if it's a child you're seeing where you have to give in CPR, we give it at 15:2. Where here you're giving 30:2, there we give it 15:2 because children more than cardiac we see problems because of the lung. So for them breathing is more important. Clear? That's it. So if you've seen such a situation and you want to communicate it, say to the ambulance, how would you communicate it? Communication is very important because I should know what you're talking about. So first we would expect that you introduce yourself. Who are you? Just brief. Where are you? Or say in your own setup, if there's a problem, you should be able to tell and communicate which area are you in. So who, where, what is the problem, what do you want? What are you expecting out of it? So you want an ambulance. So you say, I'm so and so. I'm calling from this floor. There's an emergency. This patient has collapsed. We've started CPR. We would like an ambulance. Finished. End of story. So this is how we would check. So that is what I told about when we want to see, look for the chest rise. And that is how we would look for both pulse and breathing simultaneously from the head side of the patient. So push hard and fast, 100 to 120, chest recoil, and every 2 minutes we hold, because that's the maximum a person who's giving effective compressions can do. You will always need to switch to the other person. And then at the same time we check for the pulse. We do not want to give more interruptions, because the more you interrupt, the less is the oxygen to the brain. Do you all have an AED here with you all? Any idea what an AED is? All of you must have been to malls, right? Never seen a red color device, red color bag hanging? No? Not sure? Okay. So this is an AED. It comes with paddles which go in here. What does it do is, most commonly when a person throws in a heart attack or when he has a block in the heart, what happens is, instead of the heart stopping, it starts throwing different rhythms. So there is current in the heart and there is blood in the heart. So once the blood stops, it starts throwing different currents. So for that to be regulated, we need this. Okay, what does this do is, when you plug it in, when you switch it on, it reads on its own. You don't have to read the rhythms. You don't have to be the cardiologist there. It reads the rhythms and it tells if you can give a shock to that patient or to that person, or you don't have to give a shock and just continue the compressions. Because there are different types of rhythms. So when you apply this, and if it's a shockable rhythm, it really works well. Because what a shock does is, doesn't change anything, it just stuns the heart. And it says, dude, this is not how you have to work. Come back to your regular cycle. Alright? So that is what an AED does. How do you operate? Very simple. Just connect the plug-in from here, switch it on, and press the charge button. Once you plug in, switch it on, it says analyzing the rhythm. So it analyzes on its own. And it says stay away from the person. Why? Because if I touch, this machine doesn't know whose rhythm to read. So it reads mine also, it reads his also. So that is why we stay away. And when it says shock to be delivered, press the orange button here. That's it. As simple as that. So where do we place the pads? All of you would have seen in movies, right?
Just only.
Yes. Yeah. So where do we place the pads? Any idea? So this is a person. The first one I would like to place, you have your collarbone here, right?
Yeah.
On the right side, just below that. Just below the collarbone. And the second one goes at the heart. So it has left side just below the nipple. Alright, this is the first one, this is the second one. This is where we want the placement of the leads. Say it's a kid, but you have only adult size. Then what we do is we put one in the front, one in the back. We don't cut, never ever cut. It doesn't work that way. So one in the front, one in the back would be more than enough. If it's a kid and you have to give it. Alright?
Where exactly in the front?
Center of the chest. Back between both the shoulder blades you have, right? Between both of them. Okay? So, the same. AED. Plug-in connector. Power on. Attach the pads. Analyze. Press the shock button if it says shock to be delivered. And always please never touch when the shock is being delivered, because that machine does not know whom to deliver the shock. If you're touching, even your heart will get stunned. And always we talk about teamwork, because one person cannot save life. No matter it is in the hospital, no matter it is outside hospital, it is not single person effort at any point of time. Even if you go to the beautiful of centers, it is the doctor with this team of nursing staff. So it's always team effort. And we expect mutual respect between everybody. So, how many of you all would have actually stopped for an emergency on a road? Okay, taken them to hospital? Fear of hospital? No? Okay. Anybody else has a fear of hospital, to take anybody on the road to the nearby hospital?
No.
Good bunch. But I believe a lot of people do have. Because they have that notion that if you take to the hospital, you are held responsible. Correct?
No.
Whoever is taking to the hospital, they have that notion that they are held responsible by that particular center. That they expect them to pay, or they expect them to take the responsibility of that person. It actually doesn't have to be that way. There's something called as Good Samaritan law, where you are behaving as a person who's acting as a life savior. You don't have to be, liable to the law or liable to the hospital. You can just leave them at the hospital door and walk off. That's as much as you can do. So that it saves their life. And that basically provides you protection from police, from the hospital bills, from everything. You don't have to tell who you are also, for that matter. And the most important, how to approach an emergency, like I said, conscious, unconscious patient, we go in for BLS. Conscious patient we'll talk about. So, you all tell me, what conditions do you want to talk about? What emergencies do you want to know about?
If there is
Road accident. So, okay, fine. So, road accident, how do you want to approach?
So prevent the blood loss if there is any.
Okay. So, how do we prevent blood loss? Any idea?
Yeah. So we need to stop the blood flow by.
If
Hello?
it's external, where you're able to see,
Yeah.
there are two things. You are able to see, you're not able to see.
Yeah.
If you are able to see where the injury is, apply direct pressure over it, not with your hands, please. Again, please do not use bare anywhere. Protect yourselves. You can use plastic covers, that's more than enough. And apply pressure. Apply pressure. If it's here, say it's the main radial artery which is cut off, we would expect you to apply pressure there, and always, at any point of time, if it's possible, lift the limb above the heart level. As simple as that. With gravity, it will flow more. If you are against gravity, it will be difficult for it to flow. So it will automatically come down. After a certain point of time, when you compress and when you are elevated the limb, it will stop bleeding, unless it's the main artery which is cut off. And do not try to apply tourniquets. Tourniquets, nothing but we have an habit, right, where you take something and tie it off. Correct? What happens is, when you release it, not under controlled environments, it tends to bleed lot. Or if you've held it tight for a long time, that area might die, because there's no supply of blood at all. So that area might die too. So tourniquet is dangerous if you don't know how to use it, when to release it, and all of that. Okay? Call for help, stop bleeding, do not move them unnecessarily. And what do we do if they are unconscious? Same BLS, if they are unconscious. Only thing of concern would be if they have a head injury. If you suspect that anybody is involved in a, say, head-on collision, or you know that it was they were driving very fast, involved for a lot of time, and if there is head involvement, never move the neck. We all have that bad habit of moving the necks. What happens is, this is the continuation of the brain. When you tend to move, they might be paralyzed for life, because you have all the nerves which pass through in the neck. That is why, unless we make double sure that the neck is safe, even we don't move the neck when it's a head injury. Okay, so the most important thing there is, please never ever move the necks of any person whom you think of there is a head injury. Okay, and what are the warning signs? Not everybody who comes to the hospital gets a CT brain done, right? You've had a small concussion. We don't get a CT brain for everybody, because it's radiation. So we have certain warning signs which we look into, main of which is, we ask if there's out of proportion headache. Definitely at that point where you've had an injury, you will have. But other than that, vomitings, it's the most important sign.
Blood
Any
from
fits?
ears? Blood from ears?
Yes, blood from ears, nose or mouth. Okay, ears, nose and mouth. These are the three. And you have, if, say, I'm talking to you and suddenly I have a brief period where I'm not talking. I become still. And then again I start talking. So that is a sign that there's a bleed in the brain. And they become irritable, throw in fits. All these are signs of head injury. and these warrant immediate attention. The rest can wait. Or say your friend has underwent this, she was fine talking to you, but an hour later, a couple of hours later, they start throwing vomitings. They start becoming very irritable. It means there was a small bleed which was increasing in size. So all these can be the possibilities. Only thing you have to look about is any of the warning signs are there or not. As simple as that. Any headache, vomitings, fits, bleeding from anywhere in the face, and if they are becoming drowsy or they're not responding properly. That's all. Okay? This is for head injury. What if there's a fracture? First thing is, it'll move. Pain, 1 second. Move, pain, swelling. All these are signs that it could be a fracture. Don't disproportionately try to move the limb by force. And if it's in the leg, don't try to walk over it. Because if it's a simple fracture, you try to put pressure and walk over it, it will break. It will become a compound. It will unnecessarily require more intervention. Yes, please.
Yeah. In case of breathing problem, we can try to give CPR. But in case of, if we assume that is something related to brain thing, what is that we need to do, or just call for help and wait until some help is
No,
arriving?
what do you mean? I
No.
didn't get you.
If you say there is some, you said if the person is suddenly stopped talking or started
Yes,
throwing.
suddenly stop talking in my sense is, see, I'm awake, widely awake. But
Right.
there are people who just give that staring look to you. You're trying to respond. They're sitting, looking at you, but they're not responding to you.
Right.
Alright? Or if it's anything, until there is no pulse, we don't start CPR. Okay? So it's not that if there's a pulse, but your patient or the person whom you are talking to is still, lying down,
Breathe.
but not responding to you with a pulse. It could be something else we're dealing with. May not be a cardiac arrest or may not be a situation where you need a BLS, because his heart is still functioning. Alright? So in fractures, please do not move the limb unnecessarily, and we apply. This is what we do. So first, look for swelling, redness. That is what we look for in any injury. Don't move that particular bone or don't move that particular area. Make yourself comfortable and come to the nearby hospital. This is very common because you tend to move a lot on the steps, footpaths. What happens is the ankle twists and suddenly you have a lot of pain and you put weight over it, so it starts swelling. And the pain and swelling make it so bad that when you come to the hospital, you'll be like, this is a fracture. But generally, no. If it's a fracture, you wouldn't be able to put your weight at the first instance only. So it most likely is the ligament which is injured, but that ligament also takes 6 weeks to heal. So it requires adequate rest, lot of ice pack and support. Do not weight bear. That's the main point over it. The more you weight bear, the more it is difficult for it to heal in the future. Might look okay because you will put a lot of ice pack, the pain is pulled. You take pain medications, you support it also at that time. You'll be like, in a week you'll be fine. You want to go back to work. Thing is, if you don't let it heal, it'll come back. And it'll come back with a bang later on. Next topic. I'm clear with this. Next topic, please.
If there is a paralysis on one side of the body, to stroke, basically. So, what should be done at that particular
First, you
situation?
need to identify it as a stroke.
Their one side of body is not moving, and
The
basically,
first thing is we need to identify that it is a stroke.
Mhm.
How do we identify it is with something called as FAST. F stands for facial deviation. So we look if most common questions which are asked you, did the mouth go across? That's facial deviation. And when we say the mouth is gone across, the next we ask is, are the arm and feet okay? That means we are asking for the movement on the side of the body. That indicates that it is going into a brain stroke. When we say the face is deviated to the left, we generally look for weakness on the right side because both of them would have crossed in the brain. So when the face is moved towards the left, that's a very common thing when you notice. The face is moved towards the left, or your face, my sense means that the mouth, that you notice that it has moved on one side. Then we look for the weakness on the other side. Is there any weakness pronouncedly in the lips? And then the third thing we look for is, are they able to talk? Is the speech fine? Are they able to talk well? Or is it coming in a slurry way? Or are they able to not talk at all? They might be able to understand, but they won't be able to talk. So these are the different aspects we look for when we talk about stroke. So one is face, second is arms, the third is speech. And then what we expect the best out of you is time. Why? Because there are two kinds of stroke. One is when there's a clot, second is when there's a bleed. When there's a bleed, there's nothing you can do apart from putting him into the hospital, controlling the, that is the much we can do there. But if there's a clot, there is a medication which can be given within the first 3.5 hours of start of symptoms. Not when you have seen, it's the start of symptoms. So there is an injection which can be given which breaks down the clot, and the recovery rate is really good. Okay, could be expensive, could be anything else, but that is like we are weighing it against the morbidity of life or the quality of life for them in future. So that is why it is, we say time is brain, because like if this part gets cut, it grows. This, if there's any damage, doesn't grow. It doesn't regenerate. Whatever is the damage done is done. When you go to the hospital also, what we try to do is reduce the collateral damage. We cannot bring back the part of the brain which is dead. Alright? So that is why time is brain. And these days, yes.
Sometimes it is said that you can give the very little amount of opium to that person who is paralyzed by brain.
No amount of any injections will help.
No, opium actually. It will.
Opium or opiates are basically not given for that. And you are not allowed to give any of those in stroke.
Not
Because initially it might look like it is causing a vasodilator effect. That is, it is opening up the vessels. But then no, it increases the pressures in the brain. So it is actually causing more damage. And that is not advised at all. Go to a hospital, get a medical treatment done, and even the more, how do you identify that it is because of the clot first? Anybody who has a stroke in front of you could have bled. You don't know that unless you get an imaging. Even we don't know that. That is why when we say you have to present to us early, is because we need to get an MR or CT. Only then we would be able to tell actually if it's a clot which is happening or it is a bleed which is happening, because both have two very different lines of treatment. Clot, we have to break it. Bleed, we have to stop it. So there are two very different lines of treatment we're talking about.
Depending upon the patient history, basically.
Patient history, presentation, how it started, what happened. There are a lot of factors which will come into play.
What is the chances of more? Like, is it bleed or more?
Infarct is more common. That is, clot is
More common.
Bleed usually happens in the background where he has been having blood pressures, or the situation was so that it was a high emotional drama which happened. Following that, he developed. So there are some clinching points which are there, which again depends on the patient history, how he's presented, what is the blood pressure at that particular point of time, what has been it before, was he on many medications. So many factors come into play.
One of my friend has put his head on like fridge. It was really hot. So after that he put his head on fridge. He was paralyzed from half of his body.
First of all, who has advised that to go and put the head in the fridge? For what
Actually, no one advised him. But the thing
what was the purpose to put the head in the fridge? Must have been throwing hot flushes.
Yeah, he was.
Why was he throwing hot flushes?
Hot flushes because there was heat in my side of area. So that's why he has done some experiment.
Then
but
that could be because of heat exhaustion per se. Heat, when you are exposed to a lot of heat, body tends to lose a lot of moisture. It loses all the water which is there. So your blood automatically becomes thickened. So that itself can cause a stroke.
Actually,
that's called as hypercoagulable states. That itself can cause a stroke.
So we can put the injection at that time, like if there is a clot.
First, you should
not
identify that is because of the clot. Only after that injection can be put, provided there are no risk factors for it. Because that thing doesn't know that it has to clot or break the clot only in the brain. It acts all through the body. So there is a risk of bleeding. But then again, it is weighed again the benefit of the patient.
That we actually determine in the hospital only. That
Yes.
so ambulance.
Next topic.
Choking.
The asthma patient has lost the conscious.
Asthma patient, if they're losing consciousness, it means it's time.
He forgot about the inhaler he is holding. So what we can do to get him better?
There's nothing you can do to get him better. First thing is if an asthma patient is losing consciousness, it means his body has run out of oxygen and he's not able to get out carbon dioxide. That's the most main problem in asthma. So even if you try to supplement it with oxygen at that particular time, you need to rush him to the hospital, because in asthma what happens is inside the lungs they go into spasm. You have small tubes inside the lungs. They're called alveoli, right?
Yeah.
All of that closed. So unless he is provided with that particular ventilation, there's no chance that it opens up.
So if two asthma patients will be available, if it's done in a mall.
Mhm.
So if another person is carrying same supplement, can we?
Yes, you can give. Yes, you can give.
Same supplement will be fine, or any other?
If that particular thing is available, you can very well give. There are mainly what an asthmatic carries is a steroid or it's a bronchodilator. That means the ones which open up the lung, or it's a steroid. There are only two mainly which they use. So you can use anything which is going to save his life.
We can easily.
You can use.
Okay.
There's no hard and fast rule that only this has to be used, only that has to be used. No. If he is an asthmatic, you know that he uses a particular inhaler, well and good if he is carrying it. If not, if whatever is available will work.
Thank you.
At least it releases the spasm. Next topic.
Choking.
Choking. So, a lot of people who enjoy outside food. Okay. When do you choke?
If you try to eat and breathe, swallow and breathe at the same time.
Okay. When you take, basically when you're taking a particle, you're not consciously chewing it and swallowing it. That's all. In a kid, if it happens, I understand. In an elderly person, if it's happening, I understand. But if it is happening in you and me, it is usually because we are busy on the phone, not concentrating on what we are eating. Only then we tend to choke. All right. Choking. If you're talking about, there are two manures which we do. It's called as an Heimlich manure. What we do is make a fist, help with the other hand. This is where we want you to give support. Okay? Please come. Please come. I won't hurt you. Come. Other way around, please. So this is where I would like to give support. This is my other hand. Okay? And I won't hurt you, relax. And I would give blows in the upper direction so that whatever is lodged in the airway comes out. If it's conscious. Very clearly if they are conscious. Okay? That's Heimlich. Thank you. If they are not conscious, CPR. There's nothing we talk about. If they're not conscious, CPR. This is an adult. If it's a kid, we come down to their level and do it. If it's an infant, we do it in a different way. Infants tend to choke more compared to adults.
Yeah.
What we do is, say, this is the infant for time being.
Hold them.
We hold them other way around.
Yeah.
So back. Place on our thighs. So say, this is my thigh. I place on my thigh. Use this part of my hand and give back slaps.
Yeah.
Looks like CPR, but actually I'm trying to push it out from behind.
On thighs.
We give
On thighs.
on the
No,
thigh.
on the back.
You need some support somewhere.
Okay.
Put the baby on your thigh and do it.
See, this is how I sit. This is my child. This is how I would hold. Other way. And I would give slaps this way. Alright? So that it comes out. And whenever I'm giving the slap, I make sure that the mouth is open. Because that is from where it should fall out. 5 back slaps. And then I'll turn over, put on my other thigh with the baby chest front and give 5 front slaps. Looks like CPR, but actually I'm trying to push it out. So 5 back and 5 front. That is how we do it, provided the child is conscious or the infant is conscious. If not, CPR. Always, they're not responding, it's CPR. That's about it for choking. Anything else?
From
the nose.
Bleeding from the nose, what do you want to do?
No, on the spot, if somebody started bleeding from the nose,
Why?
what?
Two things. One, they would have plucked the nose.
Ruptured.
They would have plucked the nose. That is called plucking.
Okay.
They would have plucked the nose. Second, if they have very high blood pressures. Okay, these are the two most common causes. What do we do is, you have the hard part of the bone right here.
Cartilage.
No, it's the bone, the nasal bone.
Okay.
After that, the cartilage starts. That's the softer part of the bone. Hold it there. 2 fingers, hold it there. Give pressure. And sit up straight. Give pressure. Okay? You can hold like that for 10 minutes. And over that, apply an ice pack. Why? Because the blood vessels will constrict or they'll become shrunk when you apply an ice pack. So it will stop bleeding. Even after 10, and it's very common that blood which is accumulated in the nose comes into the mouth. It's not that the mouth is bleeding. Whatever is, there is a connection between the nose and the mouth. When you put nasal drops, it comes into your mouth, right? Must have happened for everybody. The same way, the blood comes into the mouth. Spit it out. Spit it out or swallow it in. There's going to be no harm. It's going to come out in the next day. Okay?
Sometimes in summer it happens, no bleeding.
It happens.
What's the reason?
Dryness.
Dryness.
Dryness. Excessive dryness. And we tend to pluck. That's the most common reason. Most common reason. Or blood pressures. There can be some other bleeding abnormalities and all of that, but these are the most common reasons.
So how do you handle the extensive dryness in the nose? How to keep that out
Keep
of
your
that
nose, use a nasal spray, just normal saline spray. If you know that your nose gets blocked or gets dried, especially when you are in AC for a long time, it pulls out the moisture. That is why we say go out, have fun, go out. There's a lot of moisture outside. Get
Nowadays,
yourself exposed to vitamin D also. All of you must have been vitamin D deficient.
Yeah. Under-
there is a problem as of now in most of the youngs and adults, that fatty liver. Fatty liver is
Fatty liver comes because of our lifestyle. It's a lifestyle problem.
yeah. We are working professionals, so we
Even
usually
I'm
sit.
a working professional. That doesn't mean that we attribute that to working professionals.
No.
It's about how you're maintaining your lifestyle, how you're maintaining your diet.
Actually,
How
we
is
have to
your
sit for
alcohol
a
under
long
control?
hours at one place. We have to sit at long hours for one place actually.
Doesn't
So
matter. See, even if you're sitting at one place for a long time, it wouldn't cause fatty liver. Why? Because that doesn't happen just like that. It depends on what you're putting inside your mouth. Even I sit for long. Doesn't mean that I would have a fatty liver. Because I would make sure that what I put into my mouth is safer. Would act against it. Fatty liver, most common causes are red meat, lifestyle problems, alcohol. Put that under control. You should see. If you're having, even over that, if you're having, then we need to think about what is happening. But not correcting ourselves and blaming it on lifestyle is not correct.
When a pregnant woman requires the CPR, what it would be the same?
We go a little higher because what happens in pregnancy is, provided they are in the third trimester, or say 7th, 8th and 9th months, what happens in pregnancy is it pushes the lungs up. So instead of the nipple line or say 5th space, we go little bit higher. And if you're giving CPR in a pregnant lady, the child should be delivered within 5 minutes. If not, along with the mother, the child would not survive. So it's only 5 minutes time.
even if we are giving CPR,
Yes, even if you're giving CPR, that's how much the body has reserves. It has to support 2. It cannot. And I wouldn't expect that you all would know how to deliver a child. That is out of scope of anybody else. So leave it. The maximum, the best you can try and attempt is to save the mother.
And you said about the fatty liver thing.
Yes.
Right? They call it stage 1, stage 2, stage 3. If we improve
Cirrhosis.
our lifestyle mechanism, is that
Stage
reversible?
1, if we are able to get you at stage 1, you can stop the disease process. Nothing which has been damaged can be reversed, except for the skin. Inside, if something is damaged, it's damaged. hold it. Body will try to recover itself from that, but it won't revert itself completely.
So stage 2, stage 3, it's not.
No, stage 2
possible
and
to-
stage 3, you are going and calling for problems.
Okay.
Anything else? Doesn't mean I have to go by the PPT. It just is a general discussion. Nothing? All well?
Acidity.
So no-
Can you just little bit tell about the acidity?
Why? So many lifestyle problems are there.